For each of our case studies, we like to extend the perspective of a patient or a family member who's experienced the condition that we're talking about. And today we're delighted to introduce Mr. Flood, who is a parent of a child with asthma and also on the board of directors for the Asthma and Allergy Foundation of America. With that, please welcome Mr. Flood.
Thank you. Thank you, Doctor. Thank you very much. I'm mic'd. Thank you. Good morning, and thank you, everyone. My name is Jim Flood. I am an asthmatic, and I am the father of an asthmatic, a young boy, young, red-headed, little Irish-American-looking boy named Jimmy Flood. And I want to thank Brookings for inviting me to speak here today, and I'd like to share with you the story of our family, Jimmy's pediatric asthma, and hopefully give you some facts and context that help put this debate in perspective. Our story begins in the summer of 2001. My wife was pregnant with our first child, who was due on August the 8th. Well, we woke up on the morning of July the 4th, ready for a big party and a big picnic that night. My wife had been having some issues, had been communicating with her doctor, and was experiencing what she considered to be indigestion, quote unquote. We called the doctor, and the doctor said, "Oh no, I don't think it's indigestion. I think you may be in labor." My wife laughed, decided we'd have a nice leisurely breakfast, and we meandered our way down to Sibley Hospital, arriving at about 10:30 a.m. on the 4th of July. We went in, we met with the doctor. I remember I said to the doctor, "Doctor, we have a big party tonight. I need to go to Costco, and I need to buy hot dogs and hamburgers and all sorts of stuff. Will we be out of here by noon?" And I remember, for those of you who remember the Bugs Bunny episodes, you know, there's the Bugs Bunny episodes where they talk in slow motion, and frozen in my brain is the doctor's face looking at me, saying to me, "By noon, you are going to have a baby," which was a complete and total shock, to say the least. So after I got over the shock and, frankly, a few prayers and realized that the Costco trip was out for the day, I noticed in the delivery room that there was a completely different team of doctors and nurses that sort of rushed into the room, had a table, a cart, and were obviously there for a reason, which I later learned they were the neonatal care unit, because, as I now know, when a child is born 5-6 weeks prematurely, there's concern that the lungs may not function properly. So, needless to say, things moved quickly and faster, for those of you who like football, than a center can snap the ball to a quarterback. Jimmy was out and he was gone, and that was it. There was no holding the baby or bonding with the baby. It was out of the room to make sure that Jimmy was okay. For the next week, I could only visit Jimmy in the neonatal care unit, where, along with a bunch of other babies born on the 4th of July, he had his cute little white hat with his red, white, and blue ribbon. But even then, I noticed that something seemed to be slightly awry about Jimmy. He was coughing a lot, and it just didn't seem that when you held him that his breathing was particularly normal. About a week later, we went home, and that's sort of where our saga began. We noticed, literally from the beginning when we got home, that Jimmy would cough on a regular basis. He would occasionally gasp. He would sometimes spit up his food. And fairly early on, we went to a pediatric pulmonologist. We went to the pediatrician, who referred us to a pediatric pulmonologist, who did a pulmonary function test and diagnosed Jimmy with asthma. Now, asthma was the last thing in the world that I had expected to be an issue for a child. As I learned later, I had quite a few relatives in Ireland who had what my mother referred to as the breathing disease, which she failed to disclose at the time. But now that I know that there was a genetic issue and Jimmy had an issue. And to be totally frank, it was terrifying at the beginning. My wife and I would take turns watching Jimmy at night, and we laugh now, but I would literally lie on the couch and stack pillows so that when Jimmy was in the crib, I could literally open my eyes, look down, and see that his chest was going up and down and that he was breathing. Like a lot of parents with pediatric asthmatic children, at the beginning, the only thing we knew to do was to go to the emergency room. So we went to the emergency room a few times. Then, as I mentioned, went to the pediatric pulmonologist, and we got a nebulizer machine, which was completely foreign to me. So we learned very quickly to think in 4-hour increments, because basically, as those of you who treat asthma know, a nebulizer machine, like a puffer, administers a bronchodilator. In this case, he was typically on albuterol, that will open the airways immediately and at least keep him in reasonable shape for 4-hour periods. So we would literally sort of plan it out. Like, are we going out shopping? Can we get it done in the next 4 hours? Are we going to visit relatives? What do we need to do to be ready? And sort of like a kid carrying their bag with sports, from then on in, we never left the house literally without a nebulizer machine or a puffer and a spacer, although we personally found that the machine worked a lot better. We went back and forth to the pulmonologist on a regular basis and eventually learned that it would be a good idea to put Jimmy on a steroid. Now, at the time, probably like a lot of Americans, the only image I had of steroids was professional athletes on anabolic steroids. So I thought, well, certainly we don't want to put our child, several months old, on a steroid. Of course, I learned a lot more about corticosteroids, and in fact, we did put him on a steroid, which reduced the incidence of asthma attacks, but still didn't completely sort of eliminate the problem. And so we would sit there every day. We would have several good hours, and I would look down at Jimmy in the car seat, and when he would go into these coughing fits, it would literally feel like he had a gallon of water in his lungs that he was trying to expel, and he just could not get it out. Now, the other problem was, for parents with children with pediatric asthma, is they can't talk to you and tell you, until they're about 4 or 5 years old, what's going on. You obviously can tell by virtue of the fluid, by virtue of the coughing. But there were occasions, quite frankly, where I later learned that if you're really in trouble with asthma, sometimes you won't get fluid at all, and you'll be so blocked up you're not even coughing. And we had several incidents of that where we ended up taking Jimmy to the ER thinking it wasn't even asthma, only to find out that it actually was. When Jimmy got a little bit older, about 4 or 5 years old, like every little boy, his greatest interest in life was a ball. Football, soccer ball, baseball, didn't matter what kind of ball. He wanted to go out and play with the other kids. So we decided that we would enroll Jimmy in Little League. We live in Northern Virginia. We enrolled him in our local Little League. Well, as soon as Jimmy went to his first practice, it was very clear that he was not going to be able to play at the same level as other children. Jimmy was literally the slowest kid on the team. He literally was the slowest kid to get to the ball. And there were numerous occasions where we would have to take him off the field, and then we wouldn't nebulize him. At that point, we would administer albuterol through a spacer and then send him back out onto the field. And frankly, that made me very sad. And I really thought, I really didn't want Jimmy to feel different. I didn't want him to feel abnormal. So I reached out to the coach, who generally was pretty good about it, and said, look, I'll monitor Jimmy, you monitor the other kids. Starting with literally the next season, I decided that the best way to handle this was that I would just coach myself, because I was concerned, frankly, that a lot of coaches, wouldn't spend the time, the energy, and would just basically throw Jimmy out and not pay attention to him. So I tried to turn Jimmy's asthma into a teaching moment for the other children. So when we would run the bases, Jimmy would always be the last to return home to home plate, and I would make the other kids stand at home plate and wait for Jimmy, their teammate. And I would tell them and explain to them, try to educate them to the extent that I understood it, that Jimmy was just like the rest of these children, but he had this disease called asthma, which meant that on occasion he had trouble breathing, and we had to be sensitive and watch out for Jimmy. And frankly, it was very cute, because the kids on occasion, if Jimmy was a little slow getting to second base, they would come in and they would say, Coach, I wonder if Jimmy needs his puffer. Jimmy's got asthma, And I would say, thank you very much, Billy. I appreciate it. I think he's okay. I think it'll work out fine. The same thing happened when Jimmy decided he wanted to play basketball. He was the slowest kid on the team. And I remember literally calling the coach, who probably thought I was crazy, and saying, look, my son is a pediatric asthmatic. He has asthma. It slows him down. If you are here to build an NBA championship team at age 7, please let me know, and I will coach Jimmy, because I don't want to make him feel different and have you throw him out, basically, or not treat him as a normal kid. Well, time went on, and Jimmy learned how to adjust. We learned how to adjust. He learned how to articulate, and obviously we learned a lot more about the medicine. But the bottom line is that and now Jimmy's 13 years old. He had principally what was large airway obstruction, so he seems to have hit a nice balance now where he doesn't need his medicine as much. But my simple story to you is that when you are the parent of a pediatric asthmatic, you live a different life. You have to learn to emotionally and physically support a child who can't run as fast as the other kids, who has to go to the emergency room a lot, who misses a lot of days at school, who will be in the middle of a trip like we were to the Grand Canyon and have to leave looking at the Grand Canyon because he's having an asthma attack and he has to go to the doctor. And these are serious issues, psychological issues and physical issues that you need to adjust to deal with as a parent of a child with an asthmatic. And I think it's important, and my message would be that we educate parents, children, others around these children so they feel as normal as possible in their environment. Thank you very much.